also higher than the England average, and that gap is widest among children. So in 21-22, 40.1% of 11-year-olds in Birmingham were classed as either being overweight or obese, whereas the statistic in England is 34.2%. As some of us may know, ethnically diverse groups are more likely to experience poor health outcomes than white people. For example, Black Caribbean people are 4 times more likely to be inpatients in hospital based on the population proportion. So a bit of background then. So obviously, obesity rates, as mentioned, are higher among diverse communities than the general than white population. In 21-22, 42.8% of adults in Birmingham from a Black background were obese, compared to 35.2% of adults from a white background. Diverse communities in Birmingham are more likely to experience weight-related health problems due to their weight, such as heart disease, stroke, and diabetes. Just as an example, people from a Black Caribbean background are 4 times more likely to have a heart disease than people from a white background. And diverse communities in Birmingham face more barriers and a number of barriers to access weight management services, which can include, but are not limited to, language barriers, cultural differences, and just a lack of awareness of available services. So, what are some of the contributing factors that cause the disparities between diverse groups and others? So, firstly, diet. We know that diverse communities are more likely to eat processed foods and sugary drinks, and are less likely to eat fruits and vegetables. Diverse communities are also less likely to be physically active than the white population, and socioeconomic factors also have a role to play in this. For example, diverse communities are more likely in Birmingham, especially, to live in poverty and experience social deprivation. And this makes it more difficult to access a healthy food and physical activity opportunities. There are also cultural factors. For example, some cultural traditions and practices may promote weight gain and may become a tradition, for example, in some communities, to have a large meal or large proportions of food, or to even have a larger child and it considered to be healthy. So there's therefore more emphasis on eating unhealthy foods at social gatherings and generally across diets, across diverse communities where, those unhealthy foods are more common. So those are, we have some of the contributing factors. And I want to talk a little bit now about the Shape Up for Life app and how it started. So the birth of the Shape Up for Life app. So Shape Up for Life is a physical community-based tier 2 weight management program that has been running across the UK since 2012. In 2019, we launched the first Shape Up for Life app, which was delivered either as a program on its own or also to support service users within the program, within the physical program. Primarily, it was built to lower barriers using technology and improve accessibility, especially for those that did not attend a physical service. The app was developed in response to the high rate of obesity and weight-related health problems, particularly in diverse communities, which we served across the UK since 2012. And it was a response to improving accessibility. So the app is designed to be accessible and affordable for everyone. Obviously, it's free of charge for Birmingham residents, and it's also available in multiple of other languages, which I'll go into later. And the app has received positive feedback from users who reported that it has helped them to lose weight, eat healthier, and become physically more active. And also, the app was launched in 2019, but it really became more popular since lockdown and since the COVID pandemic, when more people were at home and obesity was a concern and also a risk factor to ensure that service users could still access the Tier 2 program. So some of the motivations behind Shape Up for Life are to help people in Birmingham live healthier, happier lives, to reduce the rates of obesity and weight-related health problems in Birmingham, to make healthy eating and physical activity more accessible and affordable for everyone. And this was a key point for us, whereas it's not just about losing weight, but also turning healthy eating and physical activity into something that can be incorporated as part of people's daily lives, that the health literacy element of it is accessible. So for example, the literacy level, the reading standard is in very simple English. We use a lot of graphics and videos with multiple choice questions. So it's very understandable. It's very easy to read. Also, to provide users with personalized advice and support. We know that different communities often have different um, uh, issues and priorities. So the idea behind Shape Up for Life is to cater for diverse communities and different diverse communities. So South Asian groups, Afro-Caribbean groups, for example, and also to help users track their progress and stay motivated. So there are some behavior change tools within the app. The idea being that it's not just about making the change on day one, but sustaining that change, not just for 12 weeks, but beyond the 12 weeks. So the app has, for example, activity trackers, goal setting, which are all also part of our behavior change toolkit to help users track their progress and stay motivated and actually see their progress visually. So, for example, when users log how much healthier they've been eating, it actually reflects on the Eat Well plate. So they can see, for example, that the proportion of carbohydrates may have previously been 90% of their meal, and towards the end of it, it's much more proportion to the amount of protein and vegetables and fats that constitute a healthy plate. So the app also is a lifestyle support tool to help users stay motivated. The key thing is that the app is available in a variety of languages, including Bengali, Chinese, Hindi, Punjabi, and Somali. And this makes the app accessible to people who may not speak English as a first language. The app provides culturally appropriate advice on healthy eating and physical activity. For example, the app includes information on traditional diverse foods and recipes, as well as how to be physically active in a culturally appropriate way. For example, there are some gyms in Birmingham that have ladies only sessions or ladies only groups. And there's a feature on the app called My Local where users can see what gyms and activities and classes are in their local area, as well as parks and other things like that. Um, the idea being that, one of the barriers is, for example, in the Pakistani community, ladies only sessions. So there are some parts of Birmingham where those are available, and it shows in the app that, this is not so far from you, so it helps users in that way. The app is designed to be accessible to people from all socioeconomic backgrounds. It's free to download and use, obviously in Birmingham, and it does not require any special equipment or training. So it's very simple to use and download, and it's been kept simple. So people from all socioeconomic backgrounds can use it comfortably. The app provides users with the opportunity to connect with other members of the community and interact with each other, including a forum where users can share tips and support each other. And that helps behavior change and the peer support element as well. Obviously, it's moderated by a professional, and users follow the appropriate rules, and it's moderated. And also, the key thing is really that community support. So onto user feedback now. So these are just some of the feedback we've had from users from diverse communities. I think it's good to see that people from users from diverse communities are finding that the app is helping them in their lifestyle. For example, one woman from Birmingham said, "The Shape Up for Life app has been a lifesaver for me. I was struggling to lose weight, but the app has helped me to track my food intake and exercise routines. I also found the culturally appropriate advice to be very helpful. I've lost over 10 kg since I started using the app, and I'm feeling better than ever." So Bangladeshi woman. Now, this woman actually lost 10 kg over a year. So her weight loss has been very sustained. And the key thing for her was the support on the app. So it wasn't 10 kg over 12 weeks, just in case somebody thinks that's dangerous. It was over a year. Another comment we received was, "The app has been a great help for my family. I always try to cook healthier foods for family, and the app has helped me to cook the favorite dishes in a healthier way." From a Pakistani woman in Birmingham. And we have, "I'm from India and I'm still learning English. The app is available in Hindi, which is a huge help to me. It has helped me learn about healthy eating and physical activity in a way I never knew before." So we're aiming to improve the health literacy and to educate, as well as provide the tier 2 guidance, so a lifestyle change can be made that works for individual communities. And I just wanted to pick up on the second point, because I think this is a point we probably see a lot in diverse communities, where quite often the mother is the one who's cooking for a family, sometimes a large family. And the reason I like the second quote the most is because it says, "Help me to cook their favorite dishes in a healthier way." So, for example, substituting the amount of ghee, which is clarified butter that often gets put in curries, little changes like that is something which obviously adds up over time. So here's some data insights so far. So on average, 60% of users complete 9 out of 12 weeks of the program. 40% of completers either meet or exceed their 5% weight loss target within their time frame. 80% of the users are female and 20% are male. 80% of users between the ages of 40 to 65. Now, those two statistics alone, they are fairly common across other tier 2 support services, as you may be familiar with. We have obviously been working hard to attract more men onto the program, but typically the demographic falls between 40 to 65, 80% female, 20% male. Furthermore, 90% of completers reported an improvement of 10% or more of their baseline activity levels since week 1, which means that their exercise levels are going up. Most common forms of exercise are walking or gardening, which we're happy to see because it's sustainable. the gym is not for everybody, but going for a walk in your local park or even around your local neighborhood at lunchtime is probably a lot more sustainable. The app is most commonly accessed between the evening hours of 6 to 9 p.m. We believe this ties in with the fact that we have majority female users, and also it's dinner time, so it's more likely that people will look at recipes and things like that during those times. And 87% of completers also had a more balanced eat well plate compared to week one, suggesting overall improvements in health and health literacy and lifestyle. And that's key for us, is the eat well plate, and the balance of the eat well plate is important in terms of educating users on the importance of having the right carbs, proteins, and fats, and fruits and vegetables, so that they know not to have a lot more rice than meat and vegetables, compared to how much they were having at the start of the week when they were not aware of balanced plates. So pleased that users can benefit from that impact. Of course, there's a level of cultural sensitivity within the app design, and it includes a variety of recipes for different diverse communities. For example, Indian chicken biryani, Chinese stir fry, Somali goat stew. It's also available in a variety of languages, as previously mentioned, including Bengali, Chinese, Hindi, Punjabi, and Somali. So people who may not speak English as their first language can access the app, and it's more comfortable for them. There's also culturally appropriate advice on healthy eating and physical activity. For example, traditional diverse foods and recipes, as well as how to be physically active in a culturally appropriate way. And as mentioned, it contains the My Local feature that shows users nearest gyms, park, physical activity from their house. So onto challenges and learnings. So the app has faced a number of challenges since it was launched in 2019. One of the biggest challenges has been raising awareness of the app among diverse communities. The app is available in different languages, but it's important to reach out to diverse communities directly and let them know about the app and its benefits. Another challenge has been ensuring the app is culturally appropriate. The app's designers have worked closely with members of diverse communities to ensure the app is tailored to their needs. However, it's important to continue to get feedback from communities, so we are constantly making sure that we are culturally relevant. And some takeaways which we have picked up in Birmingham is it's important to raise awareness of health interventions among marginalized groups, and that it's important to ensure that those health interventions are culturally appropriate and tailored to different communities, and to get feedback from users to ensure that they remain relevant and effective, and follow a process where we actively gain feedback from users, and those inform future updates. So that's all from me for now. Happy to answer any questions. Hand back to David. Thank you all for listening.
Okay, thank you very much, Kush. I think you can stop sharing your screen now if you want to, and if anyone else would like to turn on their cameras, feel free to do so. So has anyone got any questions at this point for Kush, please? If we haven't, I've definitely got one. Okay, so I'll make a start then. Kush, are there any approaches you haven't been able to use thus far that you think would be useful in terms of increasing engagement amongst diverse communities?
Yeah, I think one of the things is to work with community champions and local community leaders, because their endorsement is very effective. For example, engaging with places of worship, community centres in communities, and actually, having the community leader stand up there and, say this is really good and we endorse it, because that does mean a lot. And even just having sessions where we can go there, and talk to communities within the centre. I think those are obviously ways which we would be keen to explore, but we haven't been able to do so yet.
Yeah, I think that's a really good idea. And in terms of Birmingham City Council, we have a growing network in terms of community leaders. So I think it's something, we ourselves need to think about in the context of adult weight management as well. Any questions at all from anyone else?
I
Julia?
apologize if I've stunned anyone into silence. We've got something to say.
You're just on mute, Juliet.
It's the end of the day, isn't it? Sorry. Hi, Kush. Just really kind of thinking about that male population. And we know from work done previously that a lot of men will kind of participate if there's a sports or activity element to it. So I know that's really difficult online, but just wondering if there's been any feedback from kind of male participants particularly about what they'd like to see, how they've used the app, that kind of thing.
Yeah, that's an interesting point. And when we were running the sports-based program in South Birmingham, and the app was promoted, there was a better take-up because it was connected to a sports program. And previously, we've seen schemes like football programs work well. We have had feedback where men haven't specifically said they want sports related or football related. However, there has been feedback that if there could be more of a community element, for example, cricket programs or tennis programs, then that would be something which could be more fun. I think that's something which has been fed back, but I'm sure that you appreciate it's hard to without a partner to be able to facilitate those two elements. But yeah.
Thanks, Kush.
Okay, I think if there aren't any more questions, I think we'll stop there. We finished a little bit early, but that's fine. So yeah, thank you all for attending today. I hope it's been useful to you. And once again, thank you so much, Kush, for your time. We really appreciate it. It's been a really informative and interesting session. So thank you very much.
Perfect. No, thank you all for listening. Take care.
Yeah. Thank you, everyone. Bye.
Bye.
Thank you very much. Thank you.